Hello.
Hi there, everyone. We'll just give people a moment to join us and make sure your audio is working. And if you have a camera, it would be great to see your faces. We are recording this session, so by staying on, it's your implied consent that you're okay with this session being recorded. We did have numerous requests to offer a recording for people who couldn't attend the previous session or this session. It's just the audio and the presenters who are recorded, not the faces of the attendees, is my understanding. I'm just going to give it a moment. We still have people joining us quite quickly from the waiting room. Okay, well, good afternoon, and thank you for joining us today for the COVID vaccine transition learning series. Our time today is intended to provide you with a bit of a higher level overview of what this program looks like, knowing that you would have nurse immunizers who have gone through the competency requirements for their own individualized training. I'd like to acknowledge that I am joining you from the Untitled First Nation and recognize that Island Health is on the unceded territories of the Untitled, the Kwakwaka'wakw, and the Coast Salish First Nations. I offer you a moment to reflect on the lands that you are joining us from, knowing that we are privileged to work, live, and play on these unceded lands. Joining me today, I have Desiree Ord from Public Health. Desiree, would you like to give us a wave?
Hi, everyone.
And we also have Jen Murray with us, who is just off the set for the moment. So this work over the past few months has been a combined effort from Public Health and the long-term care program to support the transition of COVID vaccines being provided solely by Public Health to building the capacity within long-term care homes to do this work on an ongoing and continuous basis. I'm just going to share my screen here. Make sure we get the right one. Is my PowerPoint up? Can I get a thumbs up, Desiree? Good, okay. So you're joining us today just for some information about how to start this work at your sites. Desiree, if you don't mind taking over the waiting room for me, that would be great. Our objectives for today are to highlight the education criteria that are required for the individual nurse immunizers, review the roles of long-term care, public health, and community pharmacy, knowing that there's sort of 3 different tiers for how this work is going to look and the responsibilities there. We'll be going over the workflow for vaccine ordering and transport, as well as talk about general vaccine maintenance plans. And we do have the final bullet about considerations for surge and widespread vaccination, which based on the announcements from yesterday, we know that long-term care residents are eligible for a booster starting as early as next week. And so we'll have some comments on the details of the update and that work and considerations for your site. At the end of this presentation, we will have an opportunity for Q&A. If you can please pop your questions in the chat bar, that's an easy way for us to address the questions that they come up and hopefully skip over any repeats that might be coming as well. So education-wise, there's 3 components that are required of each nurse immunizer. So COVID vaccination is within the scope of LPNs, RNs, and RPNs, provided they have training in order to meet their professional responsibility to administer this medication. So in order to meet those criteria, there's the BC CDC e-module. And it's specific to COVID-19. It's not the full-blown, I think it's like a 15-hour course that the BC CDC offers. This is a 2 to 3 hour e-module focused specifically on COVID-19 mRNA vaccines. Included in this training as well is anaphylaxis response. The second piece of this work is BC. So originally, when this work first started, eForms was going to be the provincial data platform that immunizers would need to input the information for their immunizations that were given. That platform has now changed province-wide to be BC. So nurses will need to have, accounts with BC as well as attend training to know how to use this platform. Because this has been a provincial sort of switch, there's been a lot of work going on in the background to update the platform and the training that's available. And nurse immunizers should have received invitations for training. I believe they came out yesterday. There will be Zoom sessions happening towards the end of this week and early next to support using the new data entry setup. Your centralized resource for information or troubleshooting for BC accounts is with Public Health Informatics, and you can see their email on the screen here. For your registrants, what they require is a current BC CNM registration number. This number is used as their unique identifier for their account. All BC users, it's a part of security that they have a Island Health email. So if you're from an affiliate or a private site, it's more than likely that your staff don't have Island Health emails and an account will be created for them. A key piece of information for creating an Island Health account is knowing whether or not the person ever had a previous Island Health email account. So you'll need to send that information in because those accounts can just be reactivated if needed. The LMS module, as I mentioned, for the BC training is being updated. My understanding is it's ready to go and live Zoom sessions are happening in the coming days. The final piece for nurses to sort of sign off is a self-assessment. And a self-assessment is part of the long-term care stream for this work because all vaccines are administered under a doctor's order. So a self-assessment is the approved way for nurses to check in and make sure they have all the components needed to be able to do this work. This does look different than if a nurse was administering vaccine in, say, an immunization public clinic where doctor's orders are not part of that workflow. Here in long-term care, a self-assessment is the final piece of competency sign-off. It's important to note that Jennifer Murray is our central intake for all this information. Her email is jennifer.murray2 at islandhealth.ca, and she should be on the receiving end of your nurse's competency certificates, as well as is collecting information about your site readiness and can help navigate some of the BC account troubles that might be happening as well. When it comes to long-term care, the role for all long-term care sites is to have site-based immunizers that have met those competency requirements, or for some of our affiliate and private sites, depending on your community pharmacy provider, it may be that your community pharmacy provider is able to provide COVID vaccine maintenance at your site as well. So one pharmacy provider we know about that's been able to do this work is CareRx, but it is worth checking in with your community pharmacy to see if they have the capacity to perform COVID vaccine maintenance at your site. And most sites that I've talked to who have community pharmacies doing this work still do have trained nurse immunizers as a backup plan, just in case something goes awry or that for some reason the community pharmacy isn't able to provide in a timely way. All long-term care homes will be responsible for maintaining their vaccine maintenance lists. So up until now, you've been sending in your information that's been collected by public health to determine when they would come to your site for a clinic. In the next week or so, well, with the COVID booster, actually, everything's being sort of reset to zero, but you'll be responsible for the ongoing list maintenance at your sites to be able to know when residents have had their last dose, when they would be due for their next dose, and how to plan accordingly for those maintenance doses in the months ahead. All long-term care homes are responsible for ordering their supplies. The supplies that in this case are the low volume syringes that are specific to COVID vaccine. For Moderna, they continued to be recommended as being used to administer the vaccines. If supply was not available, then the 1 cc syringes with 0.10 increments can be used in replacement. There are transport requirements with this work for long-term care. So the long-term care homes all need to order their vaccine from your public health unit. Now, this might look a little bit different than processes that you're familiar with influenza. For COVID vaccine specifically, all orders do need to go from each site through their public health unit, and we'll talk a little bit more about that, as well as your site needs to be able to send someone who is trained in the cold chain, which is part of the immunizer training, to be able to transport that vaccine back to your site. Long-term care's role would be to report any cold chain incidents to public health, to obtain consent and the MRP order for this work, or for this vaccine. LTC is administering the vaccine as well as documenting the vaccine administration in IMS-BC, in the resident medication administration record, and on the resident immunization record. Public health, their role in this work is to be the central source for vaccine. So public health will be receiving the vaccine orders and being able to process those orders for pickup on the selected day. Public health is on the receiving end of the end of clinic tallies. So when the vaccine that you've ordered has been used on the specified day, a tally needs to be sent back to public health. Public health is responsible for the dispensing and usage of COVID vaccine, and is reportable to the province, which is why these orders need to go from each site and through public health for those accountabilities. And public health is also responsible for following up with any cold chain incidents that require reporting and direction. The community pharmacy. So if you are a site who's working with your community pharmacies, community pharmacy may be the immunizer in your long-term care home. And with that piece, they would also be the ones inputting the data into IMS-BC. The plans with each community pharmacy may vary, and it may be even location dependent. So what, using CareRx as an example, what they can provide for one site in the south might look different than what they can provide for one site in the north. So you do need to have specific discussions with your community pharmacy providers. I'll just go over the workflow here. I'm just going to stop my share here. So where this information is located for you is, I'm going to switch share screens. So the information that we'll be going over is located on the islandhealth.ca public page. So it should be open and available to all owned and operated affiliate and private sites. You'll go into the COVID section of this webpage and click on the COVID vaccine information for community vaccine providers. The workflow that I'll quickly take you through is in the ordering vaccine section. And you'll see here it's under the process for long-term care. going to make this a little bit bigger. So this workflow really goes over in detail a lot of the steps we're discussing today. So each of your sites is responsible for their own plan and ensuring that the immunizers have met their competencies, as well as the vaccine maintenance list. We do have a tool that's just going through final adjustments that will be available for vaccine maintenance list. And using this tool means that you can filter out who needs a dose for which clinic that you're anticipating, and will help support ordering as well. It's best to have a site lead appointed to this work who can act as sort of the central conduit for maintaining the vaccine lists, as well as ordering and being the contact. So your site lead completes the vaccine order form. Desiree will be going into that in a little bit more detail. And all these order forms are sent to the centralized COVID vaccine inventory email. You need to leave about 5 days room for processing. And when you're ordering what you need for a specific day. So you're not ordering stock to be kept as ward stock at your site. You're ordering vaccines for the residents that need a booster for that particular month, and that it's going to be used within a day or so of arrival at your site. With the mass immunizations that are rolling out, you'll be ordering in one batch for your site. So it'll look a little bit different than what we're saying here. So one single order form for all vaccine doses required, and then they may be administered over a series of days at your site if needed to get everybody vaccinated with their booster. For picking up the vaccine, you'll have a person designated for that work. They do need to, as I mentioned, have the training for maintaining a cold chain. You do need to make sure you have a hard-sided cooler that has a gel blanket as well as frozen ice packs. The gel blanket or water blanket lives in the fridge and goes around the vaccine, and then the ice packs is in the cooler to maintain the temperature between 2 and 8 degrees. At the moment, if your transport time is less than an hour, you don't need to have continuous monitoring. And part of that decision is due to the availability of continuous thermometers. So whether if you have a data logger or a min-max thermometer available at your site, that is best practice to use that for transport. However, there is a shortage of these thermometers, and in the interim, 1 hour transport times or less do not need to have their vaccines monitored. There's some tracking that's done in terms of when vaccine is picked up at public health. And it should be picked up, either the day of your intended use or very close to it. When you're thinking about your vaccine administration, there's components. So all long-term care residents need to have a current doctor's order for COVID vaccine. The doctor's order is good for 12 months from the day it was signed. So many of your residents who have doctor's orders from the last campaign, they would still be usable for this next mass dose. You will need to check for future doses as they're announced, whether the physician's order or nurse practitioner's order you have is still valid, depending on how long it was written. Similarly, for consent, informed consent would have been obtained about 6 months ago for your COVID boosters. The consent is good for 12 months. Anyone can revoke their consent at any time. And if there was a change in the resident status that they are actively unwell or showing signs of active death, they would not be considered candidates for vaccination at that exact time, and vaccination would need to be deferred. So there may be situations where you have consent and a doctor's order in place, but the resident at that time is not a candidate for vaccination or booster. And with the previous consent forms that were sent out, there was an option that a resident could choose consent for one single COVID booster, or they were providing consent for an entire series. For those that would have provided consent just for that single booster last time, they would need to have another conversation and informed consent obtained. In terms of documentation, as I mentioned, so it goes into IMS BC. The vaccine administration is recorded in the resident vaccine record, as well as in the resident MAR. If your community pharmacy is the provider, they will do the IMS BC documentation and then provide you with the information to transcribe to the resident's vaccine record. At the end of day, so at the end of your clinic or the day that you've administered your vaccines, it does need to be a report back to public health in the form of the end of day tally, and the information whether you're an Island Health owned and operated site or affiliate or private is here. For owned and operated sites, it's an electronic process. For affiliate and private sites, there's a paper form that can be emailed or faxed in. At the bottom of this workflow are a number of resources you can continue to use for general inquiries. The LTC coach at islandhealth.ca resource inbox. I check that one regularly, or if I'm running behind, the other people responsible for the site flag me, and I'm able to respond to questions around vaccine. And then there are other resource documents here for cooler packing requirements and cold chain management. I'm going to stop there. So with supply ordering, there's a few different supplies that your site will need. One being the low dose or the low dead volume syringes. They will be coming, be ordered through our centralized Island Health provincial warehouse. They come in boxes of 100. So the boxes won't be broken down to smaller sets. So you'd be ordering, a larger box. We do have the finalized form for ordering, and we'll be sending that out. And it takes about 2 to 3 days, I'm told, for those orders to be processed and arrive at your site. For the gel blanket, that's that second picture here. Kind of looks like a bunch of small Mr. Freezies, but they're not frozen. Owned and operated sites can order these gel blankets through our regular stores department. Affiliate and private sites, these gel blankets are easily found through Uline or CryoPack, or Canadian Tire even does supply them. This example down here at the bottom is one example of a min-max thermometer. They are on back order right now, but this is something that should be on your radar to check in with and be able to order when it is available, so that the vaccines can be monitored to best practice standards during transport. And Desiree, I'm going to hand it over to you.
Perfect. Thank you, Marina. Just give me a sec here to, trying to figure out screen sharing. It's showing me there we go. So on the website that Marina was showing a couple of minutes ago is the vaccine ordering form. So there are 2 different forms there. One is for CHS immunizers, and one is for we call community vaccine providers, or CVPs, and that includes long-term care facilities. We have made a couple of really small updates to this form that just haven't been posted yet. So it will look a little bit different, and the final version will be a fillable PDF to make it easier for you to complete. As Marina said, submitting the form about a week in advance, just to ensure that public health is able to, has enough vaccine on hand to fill your order, because at this time, the vaccine is being stored in acute care pharmacies, and we have to transport it and do those different pieces. So the only parts of this form that you really need to worry about are this top section where it says community vaccine provider. So try to fill out as much information as possible, including the site name, the date the immunizations are planned, as well as time. One thing to note is that most health units don't open until 8:30 in the morning. So whenever possible, it's best to plan your clinics a little bit later in the morning so that you're able to pick up vaccine that day. If there's a different person picking up the vaccine, put their name there just to avoid confusion when they come by the health unit. And this section here is also important, the number of vaccine doses requested. So as I'm sure most of you are aware, with the second doses for long-term care, they will be what's considered, or for the second boosters rather, they are considered the half dose, so the 0.25 milliliters of Moderna, whereas the first boosters and the first and second doses were 0.5 milliliters. So put in the appropriate quantities of each vaccine. This section here is more if you were storing vaccine on site, because we do have other providers that, for example, primary care offices that may be storing vaccine on site. At this time, it's not expected you're going to be keeping vaccine, as we said, not keeping ward stock. And the one thing I just wanted to say is we talked about if there are clinics that are happening over a couple of days, just ensuring that you do have a vaccine fridge to store that vaccine in. And as well, it needs to be monitored. So either with that min-max thermometer or a data logger, it can't go into another fridge that isn't monitored, and it can't be kept in a cooler overnight. These sections here are for public health to fill out. So that regional inbox will fill out this section, just making sure that they know which health unit to pick up from. And then the health unit will fill out this section when you come to pick up the vaccine. Most of this is quite self-explanatory. Just the transport time, that's important to note, because these vaccines can be transported for up to a maximum of 12 hours once they're thawed. We aren't seeing this so much now, but if vaccine was being moved around quite a bit, that could be more of a concern, or if you're picking up for an outlying area. This section here, once you pick up the vaccine, you want to have a look at, so date of cooler packing or time of pickup, the duration of the transport, time of arrival, and then the minimum, maximum, and current temperature if you have a min-max thermometer. There's some good reminders down here on the bottom of the form there. And this section here, monitoring vaccines. So this is important if you are going to be doing your clinic over a period of several hours and you don't have necessarily a vaccine fridge to put the vaccine in. Just some information here for monitoring it in a cooler with either a min-max thermometer or a data logger. So if it is kept in a cooler, we recommend checking the temperatures every 1 to 2 hours just to make sure that they're staying within range. The COVID mRNA vaccines are quite sensitive to temperatures, more sensitive than some of our other vaccine products. And there is some information I'll show on the website in a minute just about reporting cold chain incidents. So if the vaccine is going below 2 degrees or above +8 degrees, generally that's considered a cold chain. There is a guideline there to follow and how to report those to public health. And vaccine that has been cold chained should not be used until it has been reported to public health and a recommendation has been provided. Here's some information on transport. This probably isn't as important, as it's unlikely that vaccines are going to be transported for more than 12 hours for long-term care. However, if for some reason you are having really long transports, you could use this section. It's more when we're transporting vaccine to outlying areas. So here on the website, here is the ordering vaccine section. There is the order form that we just reviewed. Here is the ordering and pickup process that we showed earlier. Some cooler packing standards there, so it shows how you wrap the vaccine in the gel or water blankets, and that's mostly to protect it from temperature fluctuations and make sure it's not too close to the ice, because if it does touch the ice, it can become frozen and then may not be usable. And here in the vaccine storage and management section are some more resources. So the BC CDC immunization manual biological pages. So that's the information on you'd see what vaccine to give to which resident, as well as the fridge temperature form. So if you had vaccine that were on site that was being stored in a vaccine fridge, freezer temperature form, which you probably won't be using, and then temperature form instructions. And then down here is the process for reporting a cold chain incident for community vaccine providers, including long-term care. Some information on documentation and inventory, and as you've all heard, we are transitioning to IMS BC, so there's a little bit of information there. And then education and guidelines, so that immunizer skills self-assessment checklist is posted here, as well as a link to the BC CDC COVID-19 immunization competency course for nurses. And then also a section here for questions and consults. So you want to be reaching out to your local health unit if you have any questions. We are looking at adding a little bit more information to this website as well, including some information for a safety huddle you can do at the beginning of each clinic, where you review the vaccine products, the flow of the clinic, who is going to be managing any anaphylaxis events that occur. And we use that safety huddle in our other COVID immunization clinics, and it's just a good thing to review to make sure that everyone knows what the process is, what the workflow is, and what to do if there is any sort of emergency. So that information we're hoping to have posted by maybe Friday or Monday, depending on how long it takes Web Communications to get that up. I think that is it for me, Marina.
Thank you, Desiree. I'll steal your screen. And we've just got a couple more slides here before we hit the Q&A. I can see the chat rooms building there. So just a visual of what Desiree was describing there, with how the gel blanket is wrapped around the vaccine to protect it from freezing, and then the ice pack is within the hard-walled cooler to maintain that temperature of 2 to 8 degrees. This imaging is also available at the BC CDC website and was included in the immunizer training as well. So with regards to vaccine maintenance, this will be your site's responsibility to have a running list of residents who are requiring vaccine. As you know, with COVID vaccine, the frequency and recommendations have been evolving. The spring booster campaign will sort of allow for a bit of a reset and for most people in your site to be on the same schedule. However, with new resident admissions, they might not be on the same schedule that long-term care has been on, and would need to be required either doses to complete their primary series or boosters as recommended. The tool is an Excel spreadsheet that allows for filtering, and you can highlight how many doses would be needed for a clinic on any specified month or day, depending on how frequently you're offering them. As Desiree had mentioned, it's important to know the type of vaccine that's needed, because the volumes are different and will affect ordering. When it comes to timing of when to administer the vaccines, versus wastage. So there's not a cut and dry formula of, do you let your resident list build right up until a full vial of vaccine can be used? There's going to be a lot of variety out there with the number of residents at your site who need a dose. Sorry. There's going to be a lot of variety with your sites about who requires doses when. The recommendation is that people get their doses in the most timely way possible. So that's a bit different than when vaccines first rolled out and we were very conscious of every drop and nothing could be wasted. We're now in a place where vaccine is more readily available, and timing sort of is more important than wastage. So there will be some, judgment on the site of your on the part of your site about when to order your vaccines and when to be able to give them to your residents based on when residents come up due for their subsequent doses. So here we are in a place. So we're in a place now. So we're in a place now where the surge or mass booster campaign has been announced. Previously, we had information that people who were in CEV 1 or 2 categories were eligible, but now we know with long-term care and assisted living that people in those categories will be included in this larger rollout. So when you're thinking about planning for a large rollout at your site, it will be in the next couple weeks. We don't want to lose the work that's been done and the planning that your sites have been doing with getting your nurses up to competency and being able to use the ordering workflow and transport pieces that are necessary. However, we also recognize that there is a huge variety out there in readiness to be able to do this work, given the timelines that the ministry has provided us with. So right now, what we know is that based on the previous booster clinics that were rolled out, the earliest residents in long-term care, depending on their clinic, the earliest people would be eligible is April 14th. And we also know from the ministry that booster campaigns should be completed by May 19th. So for each of your sites, you're going to be in a place of looking at is your site, with the plan you have in place and the resources you have available, are you going to be able to do this work independently? For this sort of mass planning, you are able to administer the vaccine over a series of days rather than having to get it done in one sitting. We will be sending out information this week to all sites, and we'll be needing your responses because we're going to be asking you essentially, are you able to do this? And if so, just send us a few details about what this looks like, as well as your contact information. If you're not able to do this within the timelines provided, we also need to know to be able to plan on-site clinics at your sites. So a bit of, judgment there based on your sites and capacity, and also recognizing that there's a lot of variables out there with regards to staffing as well. So stay tuned. That email will be going out through your site manager groups, and responses. There'll be a quick turnaround for responses on that so that we can start with planning. So as Desiree mentioned, you can connect with your public health unit for specifics around the COVID vaccine that you've ordered or cold chain incidents. If you have more general questions, please feel free to reach out to the long-term care coach at islandhealth.ca email there. And I'll just stop my screen and head to the chat. So the first question I see is with regards to respite beds. Would they qualify for a booster even though they may only be here for a week? So the announcement with regards to this mass campaign is that it's for residents of long-term care and assisted living. And then there was an age requirement of when people in the public would be considered eligible. I believe it's 70 plus. Desiree, am I right on that? I can't remember if it was 70 or 75 plus. For respite beds, I think because they're not considered a long-term care resident, if they happen to be there while you were doing your mass booster campaign and they had met eligibility requirements, it would really depend on when they got their last individual dose, because they would still need to be 6 months from their previous dose. So I think in that you'd have to look at it on a case-by-case basis to see if they meet the requirements. You can see that Desiree has included the link to the website we were referring to in our presentation. Following this presentation, I'll be following up with a PDF of this PowerPoint, as well as some resources with the website that is your source of truth for all these documents that we're talking about. Are assisted living sites included in the spring booster campaign? If yes, will the order form be the same as the LTC form? So the process in AL looks different from long-term care, and we're still working out some of the details of what that looks like. With AL sites, all AL sites will be responsible for developing their own plans. Some AL sites might have a community pharmacy that you've worked with previously who has the capacity to do your spring boosters. Other AL sites might be relying on residents to get their vaccines through community pharmacies individually rather than being supported by an on-site clinic. And then within that, if either of those options aren't able to meet the deadline of May 19th, AL sites will also have the option of requesting an on-site clinic. So they will be included in that communication I mentioned earlier with regards to identifying whether they have a plan that they're independent with to go forward with, or whether they require on-site help. Lori has similar questions. There's still, things are less clear, unfortunately, for independent living, Lori, and we do have, there's active meetings going on in many circles about clarifying the independent living folks, because we do recognize for some of the campus of care sites, they need to consider all their residents and not just specifically designated residents. So we are seeking clarification on that. For now, the ministry was quite clear that it's long-term care and assisted living that are eligible. Do we need to order our own coolers at our sites, or will those be supplied? So those are the responsibility of the site to have. They're hard-walled coolers that need to be part of the site's own supply that they provide for transport. And that also includes those gel blankets and the ice packs. Desiree, can you comment on about preferences for a cooler? Do you have any information on that?
There isn't necessarily a preference. Any sort of small to medium sized cooler, like think if you're packing a picnic, is most appropriate, just because the larger coolers do require more ice and gel packs to keep them cold. So having something that's, just going to fit the vials that you need, as well as a gel and ice packs, is generally best. But think they aren't like special coolers or ones that you can pick up at Canadian Tire, for example. We used all sorts, from Playmate to Igloo to all of the different brands. So, but if you do have any questions, if you want to take a photo and contact our team, that's totally fine as well.
Thank you. When can we expect the tool for maintenance list? It's just about done, so I hope to have it out within the next week. We're just waiting on a couple of things to fine tune with what information is required in there. Does the immunizer require an IMSS-BC account, or is it one login per site? So I believe it's specific to each immunizer, correct, Desiree? So each immunizer does need their own account. If you're an affiliate or independent, or private site, those account holders will also need Island Health accounts to make it all line up for security purposes. And Public Health Informatics can help support getting those accounts up and running. Mark asks, are there unused doses meant to be returned to public health? If not, why is the cooler needed when Moderna is good at room temperature for 24 hours? Desiree, do you mind addressing that one?
Yes, so with the vaccines, it's recommended that they're not transported at room temperature. So that comes from the BC CDC standard operating procedure. So that is why the cooler is required. And there are times when vaccine may need to be moved afterwards. So that's also why it's required to be in a cooler. And no, there's not an expectation to return unused doses to public health.
And then can anyone pick up the vaccines, or do they need to be trained?
They need to be trained. So it needs to be someone from your site who has completed the BC CDC COVID vaccine immunizer training, because that does include information about maintaining the cold chain. So somebody who hasn't completed that training wouldn't necessarily have that same level of information.
And then question regarding most IL residents are 70 plus. If a site is able to independently support an on-site clinic while immunizing their AL and LTC residents, is that appropriate? The piece with that is really because LTC and AL have along the way have had very set clinic dates. IL residents may be on a different schedule. So it would really depend on whether or not they are eligible based on 6 months from their previous dose. And like I said, we're getting more information about IL with the last round of boosters that happened. I understood it was a bit of a moving recommendation around IL and where and how people living in IL get their vaccine. So I hope to have more clarity on that by the end of this week at best.
Marina, I have a question about that. Is part of it also due to the different consent process?
That could be part of it. So we know for people living in AL and IL that they can provide their own, by and large, can provide their own consent for the vaccine and also do not require a physician's order. Whereas we know that also looks different in long-term care where these immunizations are under a doctor's order and consent may be provided by the resident, but if the resident's unable to provide their own consent, it goes through a substitute decision maker process. So consent is definitely a piece for what that looks like in AL and IL as well as the eligibility criteria and how they access vaccine.
That's what I was wondering, just because if you've completed the long-term care education and done the self-assessment, that means you can work under a physician's order, but can't immunize independently to residents or clients who have provided their own consent. I know we're looking at that piece, but that's sort of, I think that's one of the distinguishing factors.
Exactly. Tara Lee asks, will there be a process for LTC residents to be vaccinated after May 19th? We have a few people who received their booster in December. So if that's the case, Tara Lee, then they would be part of your ongoing maintenance campaigns and should be captured on your maintenance list to know when they are due for their next dose. It still remains the responsibility of long-term care homes to continue maintenance dosing and keeping residents up to date with their COVID vaccines at the recommended intervals. I'll just give you guys a moment to collect your thoughts. I know this was a lot of information and sort of with a heightened level of awareness now that we're working under a provincial announcement for mass immunizations. So we will be, as I said, sending out that communication for you to identify whether or not you can do this work for the mass boosters independently or not, in order for public health and pandemic immunizers to be able to make plans for on-site clinics within the deadlines that we have, that we're working with. Looks pretty quiet out there. So if you have any questions that come up or need to sort of bounce a few things off anyone, please feel free to use the LTC coach. Thank you, John. That's a great reminder. There are town halls coming. So there is a long-term care town hall on Friday. That's a limited invite list that generally goes out through your site leadership. And that's one that we hold every 2 weeks. So that this will definitely be a topic on Friday for the long-term care town hall. As well, Sarah Westgate is hosting an assisted living town hall Tuesday afternoon at 1:30, where we'll be able to discuss things from a more AL focused lens with regards to mass vaccination and the announcement from yesterday.
Marina, how do we get this video?
That's a great question. I'm going to save it and it'll be posted on our YouTube channel. Usually it takes a little while for all the work in the background to happen. And then we'll send that out with our regular communication streams. It should be a YouTube link that people can access. Desiree, I see one more question that would be a good one for you. How long can we keep vaccines on site?
My understanding is that you will just be ordering vaccines you're needing for the upcoming clinic without plans for long-term storage. Although I do understand that if you're planning to say split a clinic over a couple of days and you had a monitored vaccine fridge, you would be able to, you know, store them for those couple of days. But at this point, there aren't plans for longer term storage, just because the vaccines are they're only fridge stable for about a month. So a little bit different than flu and other vaccines that we're used to that can be stored longer term. Does that cover it?
Thank you. And so knowing that this is being recorded and might be, you know, used later on for sharing information with your sites, I will timestamp it saying that this is the information we know as of April 6th at 2 o'clock. As with, you know, many things we've been working with and processes we've been working through together, we do know information changes, and we will be keeping you as up to date as we can with the information as we know it. So once again, thanking you for your hard work and your patience as we do another great thing in a big way here in long-term care. I hope you have a great rest of your day, and thank you all for joining. Take care.